Okay, so today we're going to be talking about the digestive system. This is a bit of a longer chapter, so you'll kind of have 2 days or 2 class days with which to learn this material. So the first thing we're going to do is figure out what is actually a part of the digestive system so we can put the med terms that go with it in the proper order and to the right organ. The digestive tract could have also been called the alimentary canal or gastrointestinal tract in other classes. That's why it's oftentimes abbreviated the GI tract because it's considered kind of one gigantic tube from your mouth all the way out. So we have the mouth, the pharynx, which is your throat, down the esophagus through the stomach, different intestines, and then rectum and anus. There are a couple accessory organs that go along with that GI tract. So whether it's your salivary glands or liver, a part of that we have bile ducts and gallbladder, and then the pancreas. And all of those kind of come together with the goal of hopefully digesting your food. Here's the same picture as what you would find in your textbook on page 411. It just gives you the basic rundown of where everything is. And you can see the zoomed in picture on the right of the liver. The gallbladder is kind of hiding under the lower flap of the liver there, and then how it connects in with the beginning part of the small intestine and how it connects to the stomach. So what does the digestive system do? Well, most of the time we think of, obviously, it digests, but it's a series of other things as well. So it's a process of actually bringing in nutrients. So you're ingesting, you're chewing, you're using saliva to break down that food, which kind of goes into the digestion piece as well. Mechanical meaning actual physical movement like chewing, muscle contractions, and then the chemical part, which is that saliva, and the enzymes that come with that, breaking down the food that you eat. And then as that food travels through your intestines, then a lot of those nutrients become absorbed from the food and go into the bloodstream. And then whatever is left over that is not nutritive then gets eliminated via solid waste from the body. All right, so we're going to start at the top, just running through basically the order of events and where food might touch along the way. So starting with your mouth actually has a couple different pieces that might have some kind of medical condition that goes with that. So we kind of have your palate, and you have two palates actually. You have a soft palate and a hard palate. So if you ever take your tongue and reach it up to the top of your mouth, the soft palate is the back portion or the posterior portion, the back part of the roof of your mouth. You can kind of feel it's a little bit softer than the front or anterior portion of the top of your mouth. That's the hard palate. And it's called hard and soft because it determines whether or not there's kind of a bone there above. And then you also have that little dangly bit in the back of your throat. If you hold your mouth open wide, you can see it hanging down. That's called the uvula. And it helps direct food kind of to the throat. Because, when the back of your throat, you also have your larynx or windpipe where you respirate through. So the epiglottis and the uvula here help guide that food to the appropriate tube so that way you're not, aspirating food into your lungs. So the tongue is actually one giant muscle. It's composed mostly of skeletal muscle, but you don't have any bones in your tongue. And its job is to basically move the food around, direct it back to the throat. And it's also the major organ of speech as well as taste. Your tongue is covered with taste buds, but you also use it a lot to speak. The pharynx is the fancy word for throat, and it's the thing that's actually doing the swallowing. So technically, I guess if you had pharyngitis, you would have a sore throat or inflamed throat. And then that basically is acting as that connector piece from the mouth to the next stage, which is the esophagus. Your esophagus is roughly about 10 inches long, and it's a giant tube that connects the throat all the way down into the stomach. And there's a process called peristalsis that takes place. It's an involuntary muscle contractions in your esophagus. It kind of gives you a wave-like motion, and it's directional, so that way it pushes food down your esophagus toward your stomach. And really it works all the way through the digestive system, if we think about it working through your intestines as well, but it propels the food kind of in a one-way direction through the digestive system. And that kind of prevents or helps to prevent the backflow of food, back up in the opposite direction. Your stomach is kind of like a big J, and its job obviously is to store food. There's also a bunch of acids in there to help break down food. And if you're getting super technical, there are different sections of the stomach. You're not really going to have to know in terms of a test labeling those different parts, but sometimes it can help guide a doctor to certain pieces of the stomach if there's a medical condition. But the fundus is the proximal part, whereas kind of that closest attachment there, the domed portion. The middle of it is called the body. The distal piece is the antrum. And then maybe one signature piece there is the pylorus. And it's the lower part that then eventually connects to the small intestine. So that leads into what we call the sphincter. A sphincter is just any muscle ring that kind of acts as a connector piece and opens and closes. And in this case, when it's contracted, it helps prevent the backflow of food in the wrong direction. So in this case, this is the connecting the opening between the stomach and the very beginning piece of the small intestine called the duodenum or duodenum. Either one is equally acceptable. I might even use them interchangeably when I'm speaking. Once you leave the stomach, you are now in the small intestine, and it's called small just based on diameter, but it really is a 20-foot long-ish tube that goes all the way from the ending of the stomach at the pyloric sphincter all the way to the large intestine. And this is really where the key piece of digestion is finished and where the absorption part takes place. So you need your small intestines because that's the site where all of the nutrients from the food that you ate actually gets absorbed into the bloodstream and takes it where it needs to go. And that's why the tube is so long, because it has such a big surface area. It's covered with villi, which are these tiny little finger-like projections on the inside of the intestine tube that creates such a large amount of surface area that you can absorb the most amount of nutrients. The small intestine is broken up into 3 chunks. So the first about foot of that is the duodenum. And then we have the second portion, which is about 8 feet long. That's the jejunum. And then the last portion, which is about the last third, 11 feet-ish long, that's the ileum. And that's what will then connect to the large intestine. The large intestine is much bigger in diameter, but it is a ton shorter. It's instead of 20 feet long, it's only about 5 feet long. And this connects from the small intestine, that last portion, the ileum, to the anus. And this one's job is really for absorption of water. So the small intestine is mostly focused on nutrients, whereas the large intestine is focused more on, absorbing the water, and therefore by sucking the water out of whatever it is you're digesting, that's what really creates that solid waste. The large intestine is broken into a couple different parts. So you can see we have the cecum, which is a little U-shaped pouch. That's the first portion of the intestines, of the large intestine, and you can kind of see in the picture to the right where the ileum, small intestine, feeds into that. Then you have the colon. The colon does have different portions, but you're not going to need to know that, but it kind of goes up, over, and down. And then from the colon, we have the rectum, and that's the very ending part of the large intestine, which leads to the last and final area, which is the anus, which in itself is it's a sphincter. And we learned about the pyloric sphincter connecting the stomach to the small intestine. Here is another one that basically is good because it's holding your poop in until you're ready to actually poop. And it sits at the end of the digestive tract. So now we're to the accessory organs, or things that are going to participate in the digestion of the GI tract. So first and foremost, you have your salivary glands, whose job is to produce saliva. And those chemicals contained in the saliva are really the first part of initiating breakdown of food. And then we have the liver. The liver's job is to produce bile in the context of digestion. Without bile, you would be unable to digest fats. So it does play a key role. Once the liver produces bile, then we have bile ducts, which carry the bile. It's kind of zoomed in a little bit on the right. It's kind of hard to tell. You can see how that green little gallbladder sits under the liver there. The bile ducts connect the liver to the gallbladder where that bile is actually stored. We have a hepatic duct that carries the bile from the liver where it's produced. And we also have the cystic duct that carries the bile to and from the gallbladder. So it needs to be carried to the gallbladder for storage, but then it also needs to be kind of inserted into the digestive system when it needs. The hepatic duct and cystic duct do join at a place called the common bile duct, which then carries that bile into the duodenum, that first part of the small intestine. It is going to get a little tricky when we get to the medical terms, especially relating to gallbladder and common bile duct and things like that. A lot of times we'll get terms like gallstones, and they have different medical terms kind of depending on where those stones might be located. All right, so I did a lot of talk about the gallbladder, but here it is. This is just a tiny little sac-like structure. As I mentioned, its job is to store the bile that is made by the liver. Another key player that's really kind of hard to see in the picture to the right there, it's a little bit transparent behind the stomach. That is your pancreas, and it produces a lot of products or pancreatic juices that help digest food. More importantly, I feel, is that it secretes insulin, and you might have learned in your science life up to this point that insulin is necessary for the breakdown of carbohydrates. So you need a functional pancreas for that. And then when you have insulin problems, that's when diseases like diabetes come into play. A couple other players here. We have the peritoneum, which isn't really pictured here, but it's the sac that lines the whole abdominal pelvic cavity. And it's basically just kind of a clear-like bag that everything is being kind of held together with. We also have the appendix, which you can see is that tiny little pouch there pictured to the left. It says here that it has no known function. It's kind of been recently discovered that it might have a function in the immune system, but for our purpose, we can obviously live without it, as we've seen with people that have had to get it removed. It causes quite a huge problem for being such a tiny thing, but it is attached and hanging off the cecum portion of the large intestine. And then last but not least on this slide, we have abdomen. Pretty sure you know what that is. It's basically between the thorax, where your heart and lungs are, and the pelvis. All right, so here is the pathway of food, and you can just kind of see as an overview of where it starts and ends. So now that we have the anatomy part down, we can now get to the medical terms that go along with it and the word parts. The combining forms, there's not a ton, but there's enough. So we're going to start with an, and that's going to be for anus. So ano is any of that portion. Antro is going to be for the antrum, and that's kind of one confusing part. If we remember, antrum is a portion of the stomach. So gastro also means stomach. So when we're talking about the stomach as a whole, we'll use gastro. But if we're talking about a certain portion, unfortunately, of the stomach, then you might see antro. Ceco goes with cecum, pretty self-explanatory. In this case, really, it's that portion of the large intestine. Colo and colono are used interchangeably. It's usually referenced for colon. More generally, colon is considered to be one portion of the large intestine, but it could be kind of referenced to the large intestine as a whole also. Duodeno goes for the duodenum, which is that portion of the small intestine. If you're speaking a little bit more generally, you might go with entero. Entero is a very general term that usually means small intestine. Or it could even be used more generically to just mean intestine. For example, a gastroenterologist would be a person who studies both the stomach and the intestines. Esophago is for esophagus. We'll see that again later in another chapter. Gastro I highlighted already. Ilio is for ileum. In this case, ileum meaning the portion of the small intestine. Jejuno, same thing, except this is another portion of the small intestine. So as you can see on this slide, all of the different portions of the small intestine are highlighted here, the duodenum, the jejunum, and the ileum. And then we have oro or stomato, which both have to do with the mouth, whether it has to do with things inside the mouth, or it could potentially mean kind of the speech inside the mouth. Procto and recto both have to do with the rectum. Recto seems pretty self-explanatory, but then you get to things like a proctologist, which would be this person who studies the rectum. And then sigmoido is specifically for the sigmoid colon. It's part of the colon in the large intestine. All right. So these are all the combining forms. If you have a diagram, I would suggest adding to it. Otherwise, there is a diagram in your book on page 416 if you want to go ahead and label that for a little bit of extra practice. These are all the combining forms that go along with those accessory organs, and I will tell you, it does get a little bit confusing when we get to the C's here. So let's start. In this book we have abdomino, celio, and laparo. All mean abdomen. It can get a little tricky. So abdomino seems pretty self-explanatory. But if you're performing a laparotomy, for example, that's a general term for an incision into the abdomen. And a lot of times that's more of a exploratory surgery when they're trying to figure out what's wrong with someone. They'll do a laparotomy. So that would be one example of when you might hear that. Appendo or appendico, those are both for appendix, like appendicitis, for example. Or appendectomy, when you are removing the appendix. Next we have cilio, which has to do with your lips. It is considered part of the digestive system. Now we get to a couple tricky ones. So cholangio has to do with the bile ducts. So this could be the hepatic duct, for example, or any duct in which the bile is carried. That is cholangio. Colio, or just coli, has to do with the gall, or the bile itself. So if you're talking about the bile inside the gallbladder, that could be coli. I'm trying to think. You haven't learned what bladder means yet, but bladder is cysto. So if you use coli with cysto, that could literally mean gallbladder. But that's what we would use it for, if you're referencing kind of the gallbladder itself or the bile in the gallbladder. The last one here for C is colidoco. Colidoco is referencing specifically the common bile duct. So if it's a bile duct other than the common bile duct, you would use cholangio. If you're using the common bile duct, it would be colidoco. And if you're talking about the bile or the gallbladder itself, you would use coli. Crazy spellings, tricky to keep them separate. Next we have diverticulo. This has to do with the diverticulum. And we'll get to that in a little bit, but it's basically you have a little, I guess it kind of looks like a pimple, on the outside of an organ. It's like this tiny little pouch that forms on the outside. Gingivo goes along with your gums. So if you think of, brushing your teeth to prevent gingivitis, it has to do with protecting your gums. So that's where that comes from. Inflammation of the gums is gingivitis. Glosso and linguo has to do with your tongue. Like a linguist is a person who studies, languages, or the tongue, so to speak. That's where that comes from. Hepato, you see this oftentimes before. Hepato, think hepatitis, has to do with the liver. Hernio is a hernia. This is, in general terms, a hernia is whenever you have an organ kind of protruding out from where it should be. There'll be pictures later. This can happen in your back when you have things like a slipped disc is one example, but there are digestive examples as well. Palato is your palate, so we have the hard palate and the soft palate on the roof of your mouth. Pancreato is for pancreas, pretty self-explanatory. Peritoneo is for your peritoneum, that sac-like covering of your internal organs. Polypo, we'll see this one a little bit later also. It has to do with a polyp, similar to diverticulo. A polyp is basically a tiny little growth on the inside of your intestines, for example. So when they do colonoscopy, if they're looking for intestinal cancer or something like that, they are looking for polyps, and they can remove them and see if they're cancerous. Pyloro has to do with the pylorus or the pyloric sphincter. So that connection between the stomach and the intestines. Oftentimes, if that's not functional, that's when you could have, stomach acid going into the intestines, which is not good. Sialo has to do with your saliva or the salivary gland itself. Steato is fat. And we did learn previously that lipo also means fat. So in this case, we've learned two that mean the same thing. You are more than welcome to use them interchangeably. You just have to be able to identify them if they are used in words. And then uvulo is for the uvula. That was a lot of words. Please make sure you try maybe labeling them in the diagram in exercise 5, as well as trying exercise 7, for example, on page 420. Colby. So here's a review question. In choledocholithiasis, super long word, what is the word root that means stone? Hopefully, we're saying lith. So a lith or litho means stone. And this super long word here, we have choledocholithiasis. We have a condition, if we remember, and then we had choledocho. So that's going to be the common bile duct. So we have a condition of stones, which is lithiasis, in the common bile duct, choledocho. Okay, so here's a couple pictures to kind of explain what you were taught in the word list. Diverticulo goes with a diverticulum, and that's what this is a picture of. In the large intestine, you kind of have these little outgrowths. They could potentially be cancerous, so they might want to do a test on them. Also, sometimes food can get stuck in these, or remnants of food, and can cause infections as well. Hernio, these are 3 different types of hernias that exist in the digestive tract. So the first one is a hiatal hernia. This is when a portion of the stomach kind of pokes up through the diaphragm. So normally that horizontal piece right there, if I kind of go across here, is where your diaphragm naturally would be, and so your stomach should normally sit under that. If for some reason there is a tear or something with the diaphragm and that comes up through, that could be a hiatal hernia. Also here, for gentlemen, we have this membranous wall here. If something happens, it is kind of possible, we got, prostate and things over this way, that can protrude out. The intestinal piece can kind of protrude out through this barrier wall here. Does not look super comfortable. It's called an inguinal hernia. And then lastly, that sometimes is common, this is an umbilical hernia that can happen with babies. So this is where your belly button would be, or your umbilicus, where your umbilical cord would be attached, but that membrane doesn't seal off completely, and what happens is you get a little bit of the intestines kind of poking through there. It looks pretty bad, and it could potentially be, but oftentimes they're able to kind of like put that back in, sew it all up, and you can recover. All right, so now we're to prefixes and suffixes. Clearly not a super long list. Our prefix here is hemi, so this would be half. We did notice this as we've been jumping around the book. Previously we had this with hemiplegia, which would be like half paralysis. Here we have a suffix. In case of digestion, we have pepsia. So this has to do with the ability to digest. So if you had dyspepsia, that would be abnormal or painful digestion. All right, so which of these terms means a polyp or a small growth? Polypo, pretty self-explanatory, but you can kind of see where this could exist. The one on the left is really towards the rectum. You can kind of see the spinal cord coming down. You can also get nasal polyps, which kind of go into your sinus cavities and can make it difficult to breathe as well. All right, so now that we've learned the pieces, we can kind of get to the portion of actually putting full words together to create diseases. I don't really need to go through each one of these independently, but some of them I've mentioned as we've been moving through the parts as examples. Appendicitis was one, inflammation of the appendix. You can see that through this list there's a lot of itises, whether it's diverticulitis, enteritis, esophagitis, gingivitis, glossitis, hepatitis, and so on. So there's inflammation of a ton of things. You can also have a couple tumors in different things. So you can have a cholangioma, for example, if we're talking about a tumor in the bile ducts, or hepatoma if we're talking about a tumor in the liver, and so on. As I mentioned previously when I was talking about the gallbladder, chole means gall, cysto, which we learn in a different chapter, means bladder. So if you put them together, it means gallbladder. So like in cholecystitis, this would be inflammation of the gallbladder. Lithiasis would be a condition of stones. This happens a lot in the digestive system, whether in this case it's gallstones. When we get to learn about the urinary system, we'll see something similar with kidney stones. Let's see, other things. Another thing to see here is seal. If we remember, you might have learned this term. A seal is a protrusion, so that's basically the same thing as a hernia. So a rectocele would be the same thing as a hernia, in this case of the rectum. Finally, here we have a silolith. Lith is used here kind of as a suffix, as we used it as a middle part of a word previously, but a silolith is a stone in the salivary gland, because silo means the saliva. So then that could lead to secretion of salival problems. But please take some time to go through all of these terms and at least use them one time in exercise 11. In this case on page 425. Get a little bit of extra practice before we move on to the ones that are not built from word parts. Oh, something happened with the picture here, but I'll just kind of skip to the answer. In this case, on the left, you can see we have cholelithiasis, so this would be a gallstone. In the picture here, you can see the gallbladder, for whatever reason, is always green in every diagram I've ever seen. But you can see sometimes the bile can harden and become more like a stone. And so if they're there, that's where that is. If somehow those gallstones make their way into the ducts, then it can become something else. So for example here, choledocholithiasis would be if those gallstones made their way into the common bile duct. And it can be pretty painful. And if those stones are blocking the release of bile into the duodenum, then that can cause all other kinds of problems. All right, which one of these would be an inflammation of a structure in the mouth? Looking at this, we have uvulitis would be really the best picture here, because it has to do with the uvula, which is that dangly part in the back of your mouth, versus the esophagus that kind of connects to the throat. Okay, we're now to the words not built from word parts, our less fun friends here. Starting off, we have adhesion. And similar to chemistry, adhesion is when something sticks to something else. And for medical terms, we're using it to kind of say an abnormal growing of two things that shouldn't normally be growing together. So oftentimes this could happen after a surgery, and then two membranes might then grow together that shouldn't happen. Next, we have celiac disease. This is what we would consider the gluten intolerance syndrome. But basically it means that people have an immune reaction to gluten. And if you didn't know, gluten is a protein that we find in things like wheat or rye or barley, a lot of grains. And so people with celiac disease, these grains can damage the lining of the small intestine. And then the person with celiac disease has a hard time absorbing these nutrients. And it can have some not so fun side effects like bloating, diarrhea, constipation, and so on. You could also consider this disease called gluten enteropathy, meaning that it's an intestinal disease due to gluten. You can kind of see in the picture there to the right with the arrow. On the left is what a normal small intestine portion would look like, and then on the right you can see what that looks like with celiac disease, which is why they need to, limit intake of the gluten to prevent a lot of these side effects. Next we have cirrhosis. This is a liver disease. Most of the time you might think of cirrhosis as something that someone who drinks a lot gets, but it's basically where your liver is gradually destroyed and it forms a lot of scar tissue. Hepatitis can also cause cirrhosis, but you can see this is what a happy, nice looking one looks like, and then all of the development of scar tissue here on the right. Crohn's disease is another inflammatory disease. In this case, it usually affects the large intestines, and it can also form scar tissue and lead to obstruction, but it is a chronic, meaning that it's kind of a lifelong condition, is ongoing, inflammatory disease of that large intestine. Next we have GERD, or gastroesophageal reflux disease, which is why we call it GERD. This is where really you have a sphincter problem, and the gastrointestinal contents accidentally come back up into the esophagus. So it's kind of like acid reflux, basically, where the stomach acid and stomach juices kind of backflow up into the esophagus, which can be really painful. It causes things like heartburn. Heartburn is basically the sensation of all the acid in your esophagus, and that acid is eating at the lining of your esophagus, and can be painful over time. So it's basically acid reflux disease on a full disease scale, meaning this happens a lot. Next is hemochromatosis. This is an iron disorder, which is where in your blood. So this is where the hemochromo comes in. But this is when you have too much iron in your blood, and so that you're eating too much iron heavy foods, and so because of that your body is absorbing too much iron and you get excessive deposits in your tissues. And having too much iron can be a bad thing because it can cause things like heart failure and diabetes, can kill your liver. No small things. So hemochromatosis just basically means you have too much iron absorbed into your blood, can cause all other kinds of bad things. The next fun thing on the list is hemorrhoids. This has to do with swollen or distended veins in the rectum and anus area. This can, be internal or external. It can cause a lot of bleeding or pain, but it's basically an enlarged blood vessel in the rectal anal area. Moving right along, we have ileus. An ileus is an obstruction of the intestine, and there's not a physical barrier stuck in the intestine. It just means that that normal wave-like motion of peristalsis that pushes food through isn't functioning right there. So ileus just means that kind of that wave motion is stopped, so food is now stuck. Intussusception is when there's a telescoping of the intestine. If you've ever seen a telescope like fully extended, you can kind of smush it then back up. And it's a tube within a tube kind of situation. That's what intussusception is. It's where a piece of the tube of the intestine kind of gets pushed into another. I think there's a picture of it later on. It's a bit hard to explain. Next we have IBS, irritable bowel syndrome. And this is when your bowel function kind of gets messed up on a periodic basis. It can give you diarrhea, can do the opposite and make you constipated. Oftentimes gives you abdominal pain because of that. So it's not a fun condition to have. Next up we have obesity, which just means that you, by definition, have excess body fat. There are different categories of obesity. I think I have a chart a little bit later on. Next, we have a peptic ulcer. An ulcer, by definition, is when the mucous membrane kind of has eroded a little bit. And in the case of a peptic ulcer, the stomach acid has worn away the mucous membrane of the stomach and can cause all kinds of problems, because then you have acid in areas where there's not supposed to be and can cause damage. This could result from a bacterial infection or other things. Ulcers can occur in other areas as well, but that's just one for the stomach. A lot of stress, for example, can give you an ulcer. A polyp is just a tiny little growth in the membrane. Usually it's benign, but sometimes it could be malignant. And oftentimes it's in the intestine, but it could be in other areas as well. Ulcerative colitis, or UC, is where the intestine is oftentimes inflamed and has ulcers. Pretty explanatory from the name. And last on our list we have volvulus, and this is the twisting or kinking of the intestine. So this is where there actually is something in the intestine blocked and it's causing your actual intestines, you know, the small intestine is 20 feet long, to twist and turn in a not nice way. With all of this said, please take some time and work on exercise 14. It starts on page 428 and continues to 429. To get some practice, it shows you some pictures. It continues on again actually to page 430. So get a little bit of practice before moving on to surgical terms. Here's an example picture that I just pulled to go for body mass index. The color code kind of hits on what that would be in terms of obesity as a term, meaning over 30% body fat. So you can kind of find your height and your weight and see where you kind of fall. Here's an example of peptic ulcers and where those usually are located. In this case, we have the gastric one, which would be inside the stomach. If you're having a pyloric sphincter issue, some of that acid might leak into the duodenum. You could have a duodenal peptic ulcer, or sometimes it can go all the way down a little bit more into the small intestine and cause what we call a marginal ulcer. But this brings us next to the surgical terms. And in this case, we have a couple different things. In terms of the digestive system, there's a lot of removals. So you're going to see ectomy a lot in this case. If we remember centesis as a suffix, it means to aspirate fluid, or basically suck liquid out of. So we can do that in the abdomen with abdominocentesis. If we're doing a surgical repair of something, we're going to have plasty. So we have abdominoplasty. You can also look at an esophagogastroplasty, or gastroplasty as well. Oh, sorry, I skipped one. Anoplasty is another one. Then you can do a lot of ectomies. So appendectomy is one. Cholecystectomy would be a removal of the gallbladder, for example. A diverticulectomy would be a removal of a diverticulum. Gastrectomy would be a removal of the stomach completely. Another one here, I can't remember if you were introduced to this suffix yet or not, but in this chapter we have one called stomy. So if you remember, tomy is incision, ectomy is removal, but stomy is something different. It means the creation of an artificial opening. It can also be pronounced stomy when you put it in the whole word, like this word here, number 10 is colostomy. And this would mean that there is an artificial opening created in the colon. You might have heard at one point of a colostomy bag. So for example, these are people where there has been an opening created from the colon through the actual abdominal wall to the outside world. So maybe some of these people had colon cancer or rectal cancer and can't actually, use the restroom in a normal fashion, so they have to have some other means of doing this. You might see this stomy or stomy. Here's another one, gastrojejunostomy, or gastrojejunostomy is another way to pronounce that correctly. Sometimes that has to take place in various portions of the digestive system as well. Similar to the previous ones, we have a gastrostomy. If we remember, we have raphe as a suffix here. So raphe would be a suturing. In this case, a glossoraphe would be a suturing of the tongue. Or you can have a herniorrhaphy if you need to suture up a hernia to kind of put it back into place. Ileostomy has to do with where you are placing that artificial opening. As I mentioned previously in this PowerPoint, a laparotomy would be an incision into the abdomen, oftentimes used for general surgery or exploring if they don't really know what's wrong with you. The other ones are pretty self-explanatory. A pyloromyotomy would have to focus on the pyloric muscle. That's why they're putting myo in there. This super long crazy word, which is why it has an abbreviation, is uvulopalato-pharyngooplasty, or UPPP. Crazy long, but obviously it has to do with a surgical repair of the uvula, the palate, and the pharynx. So something happened in that area. Usually it actually has to do with sleep apnea, which is when you forget to breathe when you are sleeping, or in this case, obstructive sleep apnea, where depending on your angle of where you sleep into your head and your neck, you can actually close off the windpipe area. All right, so here's an example of a PEG, or a percutaneous endoscopic gastrostomy. So this is a fancy type of gastrostomy. You can see on the left what that is actually happening, and on the right what it looks like in real life. So this would be a way to feed people, or in this case, let's say that the baby can't actually chew food or eat food or swallow food that it needs, but obviously it needs the nourishment. So this tube connects into the stomach, and you can kind of see what that looks like through the layers of skin and tubing. As I mentioned, people with certain types of cancer or injury or whatever do have to go through and have different types of artificial openings created. So on the left, we have an ileostomy focused on the ileum, and you can kind of see where that opening looks like in real life on a person's skin. And that's a newly created one, which is why the stitches are still in. On the right, you can see a colostomy. So this is connecting to the colon or the large intestine piece. And what that looks like. The person in the lower right, actually you can see the colostomy bag attached. And so that is where the waste would collect, and then the person would swap that out a couple of times a day. Here's an example of a colonoscopy and a polypectomy. So they recommend people of a certain age to go and get colonoscopies because colon cancer is a real concern. So they go in through the anus with a giant tube, and they usually have a camera, and they go along looking for polyps, which are these little growths. And then usually when that happens, they take this little lasso-y piece at the end of their probe, lasso around it, and then they can use that wire to kind of cinch it off and cut off those polyps. All right, and then lastly here, we have a couple more terms that are not built from word parts. Before you get to these, going back, I would say please work on exercise 18. That is on page 437 in your book before you move on to the next set of sections, because there are 29 surgical terms that you should practice first. Okay. Back to the ones not from word parts, we have an APR, which is an abdominoperineal resection. This is oftentimes done when someone has colorectal cancer or something wrong with the intestine. They might actually end up totally removing part of the colon, the rectum, and the anus. And there's different ways to do it. In this case, they're doing it both through the abdomen and the perineal cavity. So that's why they call it that. But then the result would mean that you have a colostomy bag, for example. Anastomosis is the next, and this is when you join two things together that were not joined to begin with. For example, if you were joining two blood vessels, or more specifically for this case, if you needed to cut out a piece of bad intestine, and then you basically just stitch up the two ends where you cut away to create, one functional intestine again. That would be anastomosis. Bariatric surgery is the term for reducing your stomach capacity. So they're basically stitching up or treating the stomach in some way with the goal of treating obesity. Hemorrhoidectomy is how it sounds, removal of a hemorrhoid. And then vagotomy has to do with cutting the vagus nerve. This is specifically focused for people that have ulcer issues. So in your brain, you have the vagus nerve, which is one of the cranial nerves. And that nerve kind of controls the amount of gastric acid that gets produced. So if you cut this or certain branches or pieces of the vagus nerve, then you kind of limit the amount of gastric acid that's produced. And the acid is what's causing the ulcers. So this is one of those crazy things that indirectly will lead to less stomach acid and less ulcers. Okay, so moving right along, this is what anastomosis looks like, whether you're connecting pieces end to end, or you're creating a new junction, or you are stitching them side by side, whether it's blood vessels or intestinal pieces or so on. You don't need to know the specific subtypes for the test, but I thought it's just interesting stuff. Here are a couple different types of bariatric surgeries that exist. So on the left, you have a typical gastric bypass. So you can see how they basically take a bunch of staples and they staple off this tiny, tiny little bit, which cuts off, I don't know, 95% of the person's stomach. And then they stitch the small intestine to that part. So they kind of cut off this small intestinal piece here, and then they reattach it here so that the food or digestion starts here. Stomach stapling gets a little crazy. You can also have a band here, but the idea is that you are limiting the amount of space that there is open for the stomach. So you kind of staple off this part, restrict this part so that food basically has to travel this tiny squeezed way, and therefore you'd fill up faster. Lastly, and kind of least invasively, we have this lap band where basically you just put a structure around the stomach, and you can control it. You can loosen it or tighten it and make the pouch for your stomach bigger or smaller, and it's more easily removed versus the more permanent surgeries like the gastric bypass. So which term has to do with creating an artificial opening? Hopefully you're saying B, colostomy. Okay, we are now to diagnostic terms, and there aren't a crazy amount. First, we have a cholangiogram. So this would be, if we remember, gram would be the radiographic image, whereas graphy is the radiographic imaging process. So cholangiography would be the actual process of taking x-rays, for example, of your bile ducts, really to see if you have gallstones. Cholangiogram is the picture that you get. CT colonography, excuse me, would be looking at the colon, in this case using a CT scanner instead of just a regular x-ray. Esophagram, this particular one is also called a barium swallow because you use contrast media, so you swallow it and then you get a nice picture of the esophagus and the pharynx just because of its proximity. Endoscopically, you can do a whole lot more. So a capsule endoscopy really has to do with you swallowing a super tiny camera and having it go through your entire GI tract, basically to look for obstructions or bleeding. It helps to diagnose things like Crohn's disease, celiac disease. Oftentimes this is also called a camera endoscopy. Some of these medical tools, we have a colonoscope, and obviously that would be the instrument used to look during a colonoscopy. Endoscope for endoscopy. Super long word is EGD, esophagogastroduodenoscopy. So this is really where they're just checking to make sure that your esophagus, your stomach, and your duodenum, or first part of that small intestine, is looking good. You can do the same thing with your stomach for the gastros. You can do it with the abdomen. You can do it with the rectum for the proctoscope and proctoscopy, and so on. So all of these have pretty much the same suffixes. It's just for a different part of the digestive tract. Take some time, do exercise 25 before moving on, just for your own self to practice the words a couple times. Here's some example pictures of a colonoscopy. You can see that A is how it actually should look. B, you can see diverticulosis. You can kind of see the little bump there on the outside. It's kind of brown. C would be a polyp, kind of hard to tell. You can see little growths there. And then D, I don't even know how to describe, but that would be an example of colon cancer. It clearly does not look happy as it does in A. When we get to diagnostic imaging and endoscopy, here we have sonography. So similar to kind of an ultrasound that they would do for babies, we can do it in the abdomen wall to look for size and structure of different things. Again, to start to look for things like gallstones. Instead of doing a barium swallow, we can do something called a barium enema, also known as a lower GI series. And this is where they insert barium rectally, and then they can look at basically the second half of your digestive system. So focusing on the large intestine. And then we can have an endoscopic retrograde cholangiopancreatography. ERCP for short, again using contrast media, but this is going to evaluate whether it's your gallstones, for example, or looking specifically at your pancreas. It'll give you a good indication of pancreatic cancer. Endoscopically, we have an endoscopic ultrasound, or EUS. So this is when they are doing probe wear, but it's using a endoscopic fitted probe, so you can kind of stick it in and get a little bit of a better picture. And I realize that a lot of these terms sound very, very similar. There's just small, subtle differences. The upper GI series is using radiographic images. You can use contrast media like barium. And this is going to get that first half of the digestive system, so the pharynx, esophagus, and stomach. And you'll notice this is similar to the one that is built from word parts that does the same thing. Here's an example of the ERCP, or the endoscopic retrograde cholangiopancreatography. And you can see the contrast media, and you can see the endoscopic probe. What is a barium enema also called? Lower GI series, you can see by the brightness that contrast is due to the barium, that contrast media, but you can get a really good idea of what the large intestine's looking like. Abnormal finding is shown in this abdominal sonography. The ST should give it away. It is a gallstones. So here's the gallbladder. Again, the reflection is due based on density. So because the gallbladder is an open area sac, it should appear dark. And you can see there's a stone there. So this would be cholelithiasis. Okay. There are a couple lab tests that occur in the digestive system. The first is done both on pets and humans when you take them to the vet and doctor. Fecal occult blood test, or FOBT. Basically, it's just looking for tiny little microscopic bits of blood in your poop. And if that's true, that could mean that you have some kind of bleed in the digestive system, or colon cancer, or something else. Finally, we have the Helicobacter pylori test. This bacteria causes peptic ulcers. So if you test positive for this bacteria, it could be a source of ulcers. All right, we're almost there. So complementary terms. These are all of the ones built from word parts. So I won't really go into a lot of detail. As you notice, a lot of them end with AL. So this is going to be pertaining to whatever portion of the digestive tract you might be, talking about. We are bringing in some of the classics. We have pepsia for digestion, phagia. So phagia, again, has to do with eating or swallowing. So if it hurts to swallow, We have dysphagia. Logist and logi we know. Malacia means a softening, if we remember. Megaly means enlargement of, so you can have those as well. Rhea means discharge, so steatorrhea would be the discharge of, in this case, fat. We learned again, lipo means fat, steato means fat. In this case, it just means that you have excess fat in your poop. Otherwise, everything looks pretty self-explanatory. So there are a ton of terms, so just make sure that you are practicing the exercise before you move to the somewhat long list of not word parts. The specialty and specialist who performs endoscopic exams. Usually this type of person who studies this would be the gastroenterologist, and their area of specialty would be gastroenterology. Okay, so not from word parts. Moving right along, we have ascites. This is when there is fluid collecting in the peritoneal cavity. So if you remember, the peritoneum is that sac that lines the kind of abdominal area. So you could have fluid buildup there. Diarrhea, I'm pretty sure you can figure out. Dysentery is kind of the extreme version. There is inflammation of the intestines, and then it causes abdominal pain and tons of diarrhea that because of that it could sometimes be bloody. Emesis is a fancy word for vomiting. So emesis just means that things are coming out of the stomach through the mouth. Feces, you pretty much know. You could also refer to it as stool medically or fecal matter. It all means the same thing. It's poop. Flatus is the fancy way of saying gas or flatulence. Gastric lavage. Lavage basically is kind of a general term for washing out. So a gastric lavage would be a washing out of the stomach, or pumping the stomach, you could say. Gavage, not to be confused with lavage, gavage is when you feed a person through a tube. So if you think back to the picture of the feeding tube we had before through the stomach, the PEG, that is one example of a gavage. You could have one all the way down from the mouth to the stomach through the esophagus as well. Hematemesis is emesis with hemato, which is blood. So it's basically you're vomiting blood. Hematochezia is, again, we have hemato, so we're meaning blood. In this case, there's blood in your feces or poop. Malabsorption just means that your intestines aren't working properly because they're not absorbing necessary nutrients. Melena is black tarry stool. Usually there's something wrong with your upper GI so that by the time you do create stool, it has digested blood, which comes and looks like it's black/tarry. Nausea just means you have the urge to emesis or vomit. Palpate means to examine by hand. So it's kind of like when you go to the doctor and they touch your stomach in a bunch of different areas and kind of press down. That's palpating. They're feeling around for different things. Peristalsis, I've mentioned throughout the chapter. Those are those wave-like motions that push food through your digestive system in a one-way fashion. Reflux. Reflux just means there's a backflow. So basically your food Your digestion should all be flowing in a one-way path from your mouth to your anus. That doesn't always happen. If it goes backwards in the wrong path, like from your stomach to your esophagus, creating heartburn, that's why we call it reflux or acid reflux. Stoma is that artificial opening. So when you have a stomy, like a colostomy or ileostomy, you create that artificial opening. That artificial opening is called a stoma. Please try the matching on page 456, just to use the words once, get a little bit of practice. Emesis is the same thing as vomiting, true or false? Yes. So next time you vomit, just say emesis. It sounds way cooler. All right. Ending the chapter, we have all of the abbreviations. The abbreviations are listed in your book on page 457. You are responsible for knowing what all of these mean and sadly how to spell them correctly. So you will need to know how to spell ERCP, which, if you remember, stands for endoscopic retrograde cholangiopancreatography. Whew. Some of these are long. But not all of them are hard. Like N and V means nausea and vomiting. At the end of every chapter, that is when they kind of put it all together for you. So there is medical language and context. So if you get a chance, please kind of practice reading through. Doing those mixed activities can help you put it all together. On page 462, you'll find this paragraph or a set of paragraphs. Practice reading it, saying the words correctly, understanding them in context. Try the multiple choice quiz at the end of the chapter to help you. But that concludes chapter 11. You made it.